Hello, this is Dr. David Pascal, and today we are going to talk about lasers, light therapy, red lights, blue lights, infrared. What's it all about? What's the big deal? Is it real? And what is it? Well, first of all, let's talk about light. There is light that is visible, and that's basically from about 400 nanometers of wavelength up to about 1,000 nanometers of wavelength. And we're going to talk about what wavelength is in just a minute. And then there is light, of course, that we can't see, like X-ray and infrared, gamma rays, all these things. There's a full spectrum of light, and we can only see a little tiny portion. And that portion is at given wavelength between 400 and 1,000 nanometers. So what is a wavelength? A wavelength is measured, light travels like a wave, right? So it's going up and down and up and down. It has, the top is called the peak, the bottom is called the trough. And if you measure from the top of one peak to the top of the next peak, that is the wavelength, okay? Then there's a thing called frequency, and the frequency is how many of those waves come by in a given unit of time. So obviously, the shorter the wavelength, then the more can go by you in a minute. The longer the wavelength, the less waves can go by. Then there's another thing about light, and light is energy. When we are exposed to it, it goes into our body, and our body may or may not have a biologic reaction. And what the research scientists found more than 50 years ago is that red light that we can see, particularly about 635 nanometers, that wavelength of light stimulates the cells of the body in many, many different ways. First of all, it accelerates cellular repair. It boosts the immune system. It actually stimulates the breakdown of fat cells. It will kill viruses and bacteria, help accelerate and increase bone density. So there are many, many therapeutic benefits. Then if we talk about resonance or energy, like in terms of vibration, if you think of a tuning fork, maybe you did this in junior high school or elementary school, where one person held a tuning fork on one end of the classroom, let's say C, and someone else held another tuning fork, another C, at the other end of the classroom, and one student hit their tuning fork. Now the waves of sound went across the room. Those sound waves hit that other fork and made it vibrate. So they came into resonance, right? Just from the waves propagating through space. The same thing with light. All of our tissues are vibrating. And sometimes if you think in terms of vibration, tissues are either vibrating normally for them, whatever they're supposed to be vibrating at. They're vibrating too quickly or too slowly. Well, when you send in red light is vibrating at the normal vibration of the human body. Then if we have tissues that are in dysfunction, then they may be vibrating too fast, too slow, and that red light will bring the tissues back into resonance. And when we have normal vibration, we quite often have normal function. So just changing the vibration of tissues has a big physiologic effect on the body. The other thing is just this straight up therapeutic benefit of light. Now, there's different ways to produce light or emit light. So one way is like with a LED, a light emitting diode, and that light is kind of diffuse, right? It's broad, it's like the light in your room, it's spread out. And another way is with a laser. With a laser, it's a beam, right? A laser beam. So what's happening with that? Well, when you have a light source, photons, energy units of light, are being emitted. Now, if it's a laser, all those photons are in unison, kind of like a marching band on a football field. They all come up together, they hit a peak together, and they come down together. So they're all going up, peak, down. And that's why it's a single beam of light. With diffuse light, right, random light, like your light bulb in your room, one photon's going halfway up, another one's already at the very top, another photon is halfway down, another is at the bottom. So it's totally random, and that's why the light is scattered. Now, in terms of putting that light on the human body for therapeutic benefit, it does not matter at all whether it is a scattered light or uniform light, whether you're using an LED or laser. The only thing that matters is the wavelength of the light. It's that wavelength, 635, that gives the most therapeutic benefit. Of course, laser companies want to sell lasers, so they say lasers are the best, but there's no research that backs that up. I've been using scattered light LED for almost 25 years. I've been using lasers for the same amount of time, and I have never seen a difference in therapeutic benefit in outcome. Now, there is another thing that happens with tissues that bodies do, and that's called accommodation. And that is, if you keep doing the exact same thing all the time to a body, it will reset to it and kind of ignore it. Bodies are a lot like moms. You know, a kid comes up to a mom and goes, "Mom, mom, mom, hey mom, 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 mom." You know, after about the third mom, the ears just kind of tune that out. I know I'm being a little silly here, but bodies do the same thing with light. If I take 635 nanometer laser and I shoot it into, let's say, a torn muscle because I want to speed up the healing of that muscle, after a short period of time, a minute, 2 minutes, the tissues are going to go, okay, yeah, we know, and you're not going to get the same benefit as if you kind of flash that light. If I turn that laser on for 10 seconds and I turn it off for a second, I turn it on for 10 seconds and I turn it off for a second, and I flash that light, then the body has a tougher time to get used to it because there's a little recovery time. So it's the same thing like if you go to the gym and you lift a weight and you just hold it, you don't get the same benefit as if you lift the weight, bring it down, lift the weight, bring it down. Because that intermittent usage, the body can't adapt to, and that is where the benefit comes. So the price difference in a light unit that's just doing constant LED out or constant laser out, the price difference in these units are, do they have the ability to flash? Are they flashing or are they not flashing? In addition to that, we found that different tissues in the body respond better to a different flash. So muscles, let's say it's 10 seconds on, 1 second off, they recover best like that. Whereas nerve tissues might be, let's say, 7 seconds on, 3 seconds off. So on my lasers, the 20 years, 25 years of research has gone into finding out what the ideal flash rate is for the tissues, and I have menu-driven lasers where we can pull up any body part, a nerve, a muscle, an eyeball, a liver, and we plug that in. It's still the exact same wavelength. It's still 635. And the frequency of the light, which is measured in hertz, is still the same. But the thing that is different is the flashing, and that's what gives an extra therapeutic benefit. We also, in my office, use another type of light, and that is infrared. Infrared is red light. but it's up near the upper end of our ability to see it. It's really going from about 780 nanometers to 1,000 nanometers. Remember, 1,000 is about our limit to be able to see, and it even goes a little bit beyond that. So the infrared that we use, the human eye can't pick it up, but it still has the benefit of red light therapy, but it has a deeper penetration. So for some tissues where we're looking for a therapeutic benefit of the red light therapy, we'll use the infrared as opposed to just the straight up red. Now, what is therapeutic benefit? This comes back to another way that we use light therapy in my office. Most people that use light therapy are using it for that therapeutic benefit, that accelerated cellular repair, that fat loss, that killing of bacteria, that tightening of the skin, that healing of the nerve. And that requires a certain amount of time. Most therapeutic benefit, you really need, more than 10 minutes, really about 15 to 20 minutes to maximize therapeutic benefit. Just like if you sprained your ankle and your ankle's swelled up and you wanted to put some ice on it, because we know that ice is going to decrease the swelling. Well, you can't put an ice cube on your ankle for 10 seconds and then go, see, I put ice on my ankle, so the swelling should be gone. 10 seconds is not enough to get therapeutic benefit. You got to put that ice on there, for about 15 minutes. Same thing like if we're doing ultrasound, like on a knee. Those of you that played football or other sports and you went into the trainer and they would do ultrasound, that's sound waves going into the body to generate heat into the tissue to speed up its healing. Again, you can't do it for 30 seconds or a minute or 3 minutes. It's just not enough time for the benefit. You can't take your steak and put it into the oven for 90 seconds and go, oh, now it's cooked. There's a certain amount of time that all therapies need to stimulate the cells and tissues of the body to change. That's what therapeutic benefit is. But a lot of the advanced neurologic work that I'm doing with lasers is not for the quote-unquote therapeutic benefit of the tissues. A lot of the neurologic work we're doing is try to put a specific stimulus into the nervous system to fire that nerve or inhibit that nerve so that you can kind of jumpstart it or normalize its activity. So quite often when I'm doing laser work, my laser exposure might only be like 10 or 15 seconds, but that is all it needs if you're using it in a neurologic stimulus kind of way. So if you're in my office and you see, oh wow, doc left that laser on me and walked out of the room and I'm getting, 10 or 15 minutes of laser care, there we're going for the therapeutic benefit. When I'm doing different testing and poking and prodding and firing your muscles and your other sensory, or your sensory part of your nervous system, like on your skin, light touch or vibration, whatnot, and then I take my laser and sweep it over your body in a very short period of time, that is when we are looking for the neurologic benefit of laser. And most doctors, most therapists, most people that are using light therapy, like 90% of them, they are looking for that therapeutic benefit. They don't, a lot of docs don't know about these advanced neurologic techniques where a very short burst of laser or red light therapy has tremendous therapeutic or neurologic benefit. Neurologic benefit, which then is therapeutic, right? All right. Let me just make sure I have covered all the things that I wanted to. Yes, I did. Oh, yeah, violet light. The other kind of light that we have in our office besides red light therapy is blue light or violet light. That is in the 380 to 450 range, and that is more beneficial to skin issues and infections on the skin or psoriasis or scars, that type of thing. So we will use violet light more for the therapeutic benefit for our patients that come in that require that type of treatment as opposed to a deeper red light benefit. I hope that was informative. I'm not sure if we have any questions. Okay, we have some questions.
How beneficial is an infrared sauna?
Yeah, so infrared saunas are interesting. I'm a big fan of the therapeutic benefits of heat, of being in a dry sauna, because that's going to stimulate, that's going to cook your body, right? It's going to heat you up and make you sweat. And when you sweat, a whole bunch of toxins are going to come out of your body, and that's fantastic. Infrared is putting infrared light into your body to heat your body up from the inside by shaking the molecules, and that I'm not as big of a fan. Yes, you will sweat the same, but in my mind, a dry heat sauna is infinitely better than an infrared sauna, because the whole idea is to get things out of your body, and shooting beams of energy into the body to get things out just, to me, doesn't make as much sense as like a dry heat sauna, although infrared is less expensive, takes up less room, and I believe is a bit quicker.
Is an infrared sauna beneficial on the cellular level?
Yeah, so again, infrared is going deeper, and it depends on that wavelength. The IR saunas that are trying to generate more heat are higher up. They're over 1,000 nanometers, and really the biggest therapeutic benefit to the body is way down about 600, 35, 650. So you're going to get some benefit, but not as much, because that's not really where the cells resonate at. The biggest benefit from the infrared will be the generation of heat and the elimination of toxins.
Actually, what is it called?
Nanometers, yeah.
What's the difference between the different red lights? Because I've seen ones that are like lower nanometers, and then I've seen ones that are higher nanometers.
Right. So remember that visible light is really from about 400 nanometers to 1,000 nanometers, and red light really starts about 600 and goes to around 8 upper 8s, 9, some even to 1,000. So let's say 550 to 950 ideally. Now, the more specific, what the research shows is that 635 nanometers is the best frequency for the body, but it can be less expensive to make a light that is at 700 than it is at 635, or even 600 is cheaper than 635, because the more exact you are, then the higher the quality of the diode. So it all looks to the human eye the same, but on a therapeutic level, the biggest benefit is closer to 635. So when you're looking to buy your own home red light therapy device, try to find something that is, between 620 and 670, as opposed to outside of that range. It'll be a much more therapeutic benefit. Okay, well, you're always free to ask more questions. This will be posted on our Facebook page, and we do look at it. And if you have any more questions specific to red light therapy or lasers, post, and we will get back to you. I hope you are having a great day, and we wish you all the best on your health journey.